everyone. Thank you so much for joining us today. I want to introduce our guest speaker, Andrea Reyes. She is a cancer education specialist from Columbia University.
Hi, Luisa. How are you?
Hey, how are you? Thank you so much for joining us today.
Thank you.
Yeah, so I wanted to give everyone an opportunity for you to introduce yourself and give them a little bit of information about you.
Sure. So my name is Andrea Reyes, and I am a cancer education specialist from the Columbia University Medical Center's Cancer Center, the Herbert Irving Comprehensive Cancer Center. And I'm here today. Thank you for inviting me to Hispanic Federation and to you, Luisa, specifically, to talk about lung cancer, to give you information and facts and prevention information and more.
Thank you so much for having. We're so grateful for having you. The Hispanic Federation loves to have you and to be able to provide this to the community. So I want to jump right into the questions. What is lung cancer?
Sure. So lung cancer is a disease in which cells in the body, in the lungs specifically, become damaged and start to grow out of control. It is the leading cause of cancer death in the United States. Skin cancer happens more often, but lung cancer is the one cancer that's leading in all of the deaths in the US.
Perfect. How do you get lung cancer?
So there are things that very much increase your risk for lung cancer, and this is how you get it, right? The number one cause of lung cancer is cigarette smoking. Although smoking other things like other types of tobacco, such as pipes and cigars, and breathing in secondhand smoke also are causes of lung cancer. And also, when you're exposed to those things, they put you in higher risk. There are some other things other than smoking, like being exposed to substances like asbestos or radon at home or work, and having a family history of lung cancer. So, to reduce your risk, definitely avoid all smoke and smoking. Exposures to radon, which is a gas that occurs naturally out of the earth, but when people live in homes or in that have basements or live in basements, there may be radon coming into the basement and you don't even know it. But you can actually get your home checked for it. So that's a really good benefit from the city. They'll check you. And also having a family history of lung cancer. If you have relatives or parents or grandparents that had lung cancer, that's a big risk factor. And you want to make sure you report that to your doctor. Not everyone knows about their family history because they don't know their family or they have very small ones. But if you have family members that you can ask, always ask about your family history of any cancer, and report that to your doctor. Write it down, hand the piece of paper to your doctor. And look, this is what runs in my family. What do I need to do differently?
So, what are some of the symptoms of lung cancer? What are some of the things that maybe people should be looking out for?
Sure. Really important. Sometimes there are no symptoms at all, right? Someone starts getting abnormal cells in their lungs. They're not going to feel it necessarily. But it's important to note there are two types of lung cancer. One is called small cell and one is called non-small cell lung cancer. But the symptoms are roughly the same, and the symptoms among men and women are roughly the same. So the symptoms might include losing weight without trying to lose weight, bone or joint pain, headaches, and dizziness, but also a dry cough that you have always and it doesn't go away. You might cough up blood during the dry coughing. You might have trouble breathing, get what they say shortness of breath, where you're just doing anything and you're just winded all the time. You might have pain in your chest or lungs, or also feel very tired.
Okay, perfect. So, who should be scanned for lung cancer?
Okay, so it's important to know that there's only one recommended screening test for lung cancer, and it is the low dose CT scan, or the long name is a low dose computed tomography. But if you say low dose CT scan, you're fine. During the scan, you lie on a table and you're like wheeled into an X ray machine that's circular, and you get X rays taken of your lungs. It's called low dose because it uses very little radiation to take these images, and you actually get a very detailed series of images of your lungs. The scan is not painful and it takes just a couple of minutes to do. There are certain people that should be checked. It should be what we call screened, right? So people who have smoked a pack a day for 20 years or more, right? Pack a day is very heavy smoking. And people who are smoking now or
Mhm.
have quit within the last 15 years, but still smoked a pack a day. And typically we check people who are older, unless you're having symptoms and you're younger. So you've got to be, typically people are between 50 and 80 years old when they're going in for their first CT scan. Although younger doesn't hurt, you can do that as well. Also important, most insurance plans and Medicare will pay for the lung cancer screening tests.
Mhm.
So you want to check with your insurance plan to see if you can go before age 50 or even if you're covered, but you should be.
Perfect. How is lung cancer diagnosed and treated?
Okay. So first, if lung cancer is diagnosed, there it's not just with the CT scan. There are other tests that are done to find out how far it has spread through the lungs, if
Mhm.
it's spread to your lymph nodes, which are glands in your body that carry things from one point to the other. They can carry cancer cells from one point to the other, and they will check to see if it has gone into the rest of your body. This process is called staging, and it depends on how much it has spread. It can be stage 1 through stage 2, 3, or 4. The type and the stage of lung cancer tells doctors what kind of treatment you'll need. And then there's treatment. You can get treatment in several different ways depending on the type of lung cancer. Remember, because I said there's two types,
Mhm.
and also how far it's spread. So it's very specific to the individual and what their situation is. But the treatments include surgery, chemotherapy, radiation therapy, something called targeted therapy, or a combination of these treatments. And so your doctor, if someone is diagnosed, the doctor would go through all of these treatment options with you and let you know what they think you should be having.
Perfect. So, is there any way that you can tell us a little more about lung cancer among people who never smoked?
So yes, people can get lung cancer even if they've never smoked, and
Mhm.
it's because it can be caused by things other than smoking cigarettes, pipes, or cigars. There's other risk factors, right? You can spend your life breathing in secondhand smoke because you live with smokers your whole life and you're breathing in smoke, and that can actually lead to lung cancer as well. You can be exposed to high levels of radon. You can live somewhere where there's lots of air pollution, or you can have a family history of lung cancer or have been exposed to something called asbestos. Houses can also be checked for those, and apartments as well. In the USA, about 10 to 20% of lung cancers each year happen in people who have never smoked or smoked fewer than 100 cigarettes in their lifetime. So, um, researchers and cancer doctors estimate that there's in the United States about 7,300 cases of people who get lung cancer because they're breathing in smoke from somebody else smoking. So that's secondhand smoke. And so non-smokers want to lower their risk for lung cancer by getting their home tested for radon, asbestos, and taking steps to lower radon if that level is high, and keeping away from smoke and doing your best to keep away from air pollution. Although I know it's very difficult because we live in New York City. But and also learning your family history, right? That's something that you can do to help prevent, and you can talk to your doctor about your family history, and not just lung, but for any cancer.
So, I have a couple of little silly questions.
Of
Um,
course. No question is silly.
Yeah, I have just a couple of little questions that I always constantly hear among the population. So, is lung cancer something that you should be screening regularly for, like as a regular routine screen, like we go annually to our visits? Is that something that we should be doing annually as well, screening for lung cancer?
Typically, no, unless you're a smoker, unless you've had heavy exposures to smokes or to smoking and that's smoking any product, of course, or
Mhm.
chemicals. It all depends. It's something that you want to speak to your doctor about and say, look, this is what's going on with me. And your doctor can determine if screening is right for you. Most people don't go in if they haven't smoked. But if someone is curious and wants to know, then it's definitely, I urge a conversation with your doctor and see what you can do.
Another question that I kind of see that comes up a lot is there an age limit for this? Is there, like, breast cancer and colon cancer, there's ages that are recommended that you start having those tests done. Is that the same situation for lung cancer?
Yes, 100%. They say start at about age 50 to get your CT scans to make sure that your lungs are clear.
Perfect. So I also have one more question.
Of course, all you want.
Is it very common for someone to have lung cancer and not have smoked, not have history? I know that sometimes people get scared with the fact of this, but is it something that is common? Is it something that should prevent people from having those questions with their doctors?
Um, Okay, there were several questions in there. So, is it common? It's only between 10 and 20% of lung cancer cases are of people who have not smoked, but
Mhm.
people who have typically had other exposures. There's a smaller number within that of people who haven't had exposures that they know of and still have
Mhm.
lung cancer. But the vast majority of lung cancers are because people are or smoking tobacco products or exposed to smoke.
Okay, and I have
Yeah.
one more question for you. And
Mhm.
anyone here who has questions today, please put them in the chat. If you come up with questions later on, you can always put them in the chat and we'll make sure to kind of address your questions
Yeah.
accordingly. So there's a lot of controversy with the vaping. Can you have lung cancer if you vape?
Right. So vaping puts people think that they're getting no chemicals or it's not as dangerous. It
Mhm.
is still dangerous for your body and not good for your lungs at all. It's just a different set of chemicals that are going into your lungs. People vaping is a new thing, and
Mhm.
it hasn't been around for 20, 30, 40 years. So I think that we're going to see the effects of that a little bit later on because cancer takes a very long time to develop in some cases. So someone that starts smoking now and then quits might in 10 or 20 years start to have effects in their lungs that are visible or that they feel or that can be seen as on a CT scan, even if they don't feel it. So that's something to keep in mind, for people who have been smokers of any products and quit, they might want to report that to their doctor to see when together you can decide when you should get screened.
Perfect. And on another note, since you said people should refer with their doctors, is being around someone who smokes or vape, is that something also that can put you at risk and you should have those conversations with your doctor to maybe get tested or screen it?
100%. Um, you know, the random person walking down the street that might inhale a cigarette from the person in front of you walking, that's not something that you necessarily need to worry about. It's more if you have had a very consistent and long lasting exposure to side stream smoke, right? Or secondhand smoke. So if you're as a young kid and your parents were smokers and you lived with them for the first 20 years of your life and they smoked, even
Mm-hmm.
if it was, like people say, oh, I'm smoking in the window, it's not coming in, it's coming in, right? Children are breathing it. So even if it's something like that, where as a young child you were exposed for many years, or if your spouse smokes and you don't, and they do so in the home, all of that should be reported to your doctor because your doctor can best determine when it's going to be the right time for you to get your lungs checked.
Perfect. Thank you. Thank you so much. This information is so beneficial. And I know that there's so much more questions surrounding lung cancer and symptoms and checkup. If you guys have any questions later on, please put them in the chat and let us know. We'll make sure to get these questions answered. I really want to take this opportunity to thank you so much for providing us with this information. Thank you so much for giving us the resource and the tools, to get screened, to get checked. Is there anything that you would like to share before we kind of log off with our audience today?
Sure. So talk to your doctor, right? Because it's too much for me to say here in these last few seconds, but make sure that you're getting all of your cancer screening checkups, right? So some people may see this video and say, oh, but I've never smoked, I'm fine. But are you getting breast, colon, prostate, and other checkups? Are you getting, cervical? Are you getting your pap smears every year? Are you getting your mammogram every year? If you're over age 40, if you're younger, are you getting your pap smears? If males and females by age 45 should getting their colonoscopy their first, and then the doctor will determine based on what the doctor finds if you're going to continue to go. Like you can come back in 10 years or you can come back in a year depending on what's found. So if you don't know what you're due for, just next time you go to the doctor's office, just say, hey, look, cancer checkups, what do I need to do? This is what I'm doing. I don't know what I haven't done. And they can let you know, and then you can make your appointments and make sure that you go. Okay, because
Thank
that will
you.
save lives.
Yeah,
People getting
absolutely.
consistent checkups saves lives.
Absolutely. Thank you so much for this information. It is
Sure.
great having you. And until next time.
All right. Thank you. Thanks for
Thank
having me today.
you.
Always a pleasure. Bye bye.